Are you feeling a little confused about what therapy is and what therapy isn't? Who can blame you? The examples that we see on TV in the movies leave leave us to think therapy is unethical and crosses boundaries. And so I wanted to take a little bit of time to just talk a little bit about some of the misconceptions and hopefully shed some light on the therapy process. Because I know people are struggling with mental health issues at an alarming rate. And, in the absence of what we don't know, our minds can go to confusing or anxiety provoking thoughts or ideas. We grab hold of whatever reference that we have, and it can be very confusing and overwhelming and then prevent us from seeking the help that we need. So my name is Nicole Shiner. I'm a registered psychotherapist in Ontario, Canada, and I am the owner of Peace and Possibility, which provides virtual counseling for people in Ontario, walking therapy local to my area, the Grand River, as well as consultations and presentations for organizations. So I've been seeing some advertisements lately where people are saying bubble baths are my therapy, art or creative activities are my therapy, reading or going for a country drive is my therapy, exercise is my therapy. And that is not therapy. So those are wonderful practices, mindful practices that promote creative expression and connection, coping strategies, healthy coping strategies that I certainly encourage my clients and that I try to engage in to support my mental health. But that is not therapy. The examples that we see on TV and movies, that's not what therapy is. Therapy is practiced by regulated health professionals who have done years of training, have to maintain professional development, and have to adhere to ethics, an ethical code that is for the protection of the public. As clients, you have rights. And as therapists, we have responsibilities. One of the most important aspects of therapy and what differs it from coping strategies and self-help is the therapeutic relationship, the connection between the client and the therapist is in itself healing. It is reparative. When you get to be with, whether that's in person or virtual, but you get to have someone's undivided attention, someone's unconditional positive regard, someone who is helping you to stay grounded in the present, a safe and calm co-regulating presence. They're helping your nervous system to be regulated so that you feel safe enough that you can take in information and that you can connect with your body and with your emotions in a way that allows you to tap into your inner resources and what you need to heal and to thrive and to transform. So coping strategies are great, but they are not what therapy is. Therapy is so much more, and there's lots of different modalities, approaches, theories that those of us that are trained, that we draw on and that we use. But ultimately, the most influential aspect of therapy, what actually helps the brain to literally to change, to rewire, what allows people to increase their window of tolerance for distress, to learn how to connect with themselves in a non-shaming way, but in a way that invites compassion and curiosity, is that compassionate witnessing and connection to the therapist. So if you'd like to learn more about me and how I practice and what I bring to the therapy relationship, you can check out my website below. And something that is really important to remember is that it might take you a few therapists before you find that right fit. And your comfort level, your connection, even just that intuitive knowing or feeling that you're with the right person, that is so important. And it's important for you to honor that. And it's important for you to give yourself permission to change your mind. If you start with someone and it doesn't feel right for you, you're not stuck. Sometimes it takes a few people, or sometimes we start with someone and then a few months or years or even decades later, we work with someone different, and we're different people essentially, as we journey through life.